performed hand hygiene, I am going to go into my patient's room, and to respect the patient's privacy, I am going to close any doors or draw any curtains if needed. Okay. Good day, Mr. Pereville.
Good day.
Yes, I am Nurse Rae-Yanne, and I will be taking your vitals today. Before I begin, could I get your first and last name?
TJ Pereville.
Okay, and what is your date of birth?
2012, September 6th.
Okay, can you repeat the year for me?
I'm sorry, 2004.
Okay, thank you. Okay, so right now I am going to be taking the radial pulse. So I'm going to do it bilaterally. So I'm going to take the tips of my index and my middle finger, and I'm going to have the patient just be very relaxed. Now, before I begin, I'm going to ask the patient a few questions. So, Mr. Pereville, have you had any hot or cold drinks just before the vitals?
No.
No. And have you recently exercised?
No.
Okay, so he's good. So the vital signs, it should be within the normal range, or there's no obstacle making us have any abnormal values or incorrect readings for him. Okay, so right now I'm going to check the radial pulse bilaterally. Okay, so I'm going to check it for 30 seconds. Okay. Okay, so I'm going to have him relax his arm. Could you relax it? Okay. And then 30 seconds. And then you multiply it by 2. Now, if it was not within the normal range, I'd have to check it for a full minute. Okay, so it's 72 and it's 2+, which is normal. Now I'm going to still have my hand on it, and I'm going to be checking for the respirations for 30 seconds, and then I'm going to multiply it by 2. Okay, his respirations were 16 beats per minute. Okay, because I multiplied it by 2. Okay, so now I'll be taking your blood pressure. So could you relax your arm for me? Okay, so right now I'm taking the blood pressure. You want to ensure that the arm is bare, so no clothes are hindering. Okay, and then you want to ensure that the arm is at rest with the heart, so it's in line with the heart. Okay, and then now what I'm going to do, I want to feel the brachial artery. So I'll use the tips of my index and my middle finger. Okay, so I feel it, it's right here. Okay, so now I'm going to take the blood pressure cuff, and you want to ensure that the blood pressure cuff is the appropriate size for the patient, because if it's too big or too small, you're not going to get accurate readings. Now, you want to ensure that it is 80% of the patient's circumference and 40% of the patient's arm width. Okay, so now that I've said that, I'm going to the blood pressure cuffs. It has the left and right arrows pointing down. So since this is the left arm, you want to put the blood pressure cuff, but the left arrow going down on top of the brachial artery. So you want to place the blood pressure cuff at least 1 centimeter above the elbow. Okay, place it right here, and you do not want to put it too tight. Okay, so to ensure that it is not too tight, you could use 2 fingers. So I'm going to use my index and my middle finger to ensure that it can go in, and I did that without any resistance, so that's good. So it's good. Okay, now I want to put the manometer where I can see it to get the reading. Okay, and then I am going to use my stethoscope. You could use your the bell or the diaphragm to get the brachial pulse to find it. Okay, so I'm going to look for it now. Okay, and I can hear it. Okay, so I'm going to now when getting the pressure, you look for the systolic and the diastolic pressure. Now the first beat I'm going to hear, I'm going to turn the valve clockwise, and I'm going to inflate it between 180 and 200 millimeters of mercury. And the first beat, I'm going to turn it anti-clockwise, 2 milliliters of mercury, and I'm going to the first pulse that I hear, the first beat that I hear, it will be the systolic pressure, and then no sound, that will be the oscillatory gap, and then the last beat I'm going to hear would be the diastolic pressure. Okay, so right now that's what I'm going to do. So I'm going to have my stethoscope on the brachial artery. Okay, and then I'm going to make sure that I can see the manometer. Okay, so I'm going to turn it clockwise now. Okay, and then I am going to inflate it. Okay, and then turn it anti-clockwise. Okay, so it's done. So his blood pressure was within normal limits. It was 110 over 70 millimeters of mercury, which is within the normal limits. So I'm going to remove the cuff. Okay, now the normal limits is between 120 over 80 millimeters of mercury. If it was abnormal, the nurse would have to go in the room and look for interventions, so probably medications or different interventions to get that blood pressure within the normal limits. Now I'm going to take the apical pulse. So the apical pulse is you're gonna go the midline, and it is the 5th intercostal space. Okay, so it's right here. So I'm going to use my stethoscope, and I'm going to use the diaphragm of my stethoscope, and I'm going to count it for a full minute. Okay. Okay, and it was 82, which is normal. Last thing I want to check is the peripheral pulses. So I'm going to use my middle fingers to check for those. So I'm going to use my index and my middle finger, okay, the tips of it, and I'm going to check for the carotid artery. The carotid pulse. Okay, and then it's 2+. Then I want to go over to the femoral. Okay, Okay, and it's 2 plus as well. Then I will go to the popliteal, two plus, and then the posterior tibial pulse, which is at the back of the knee. So I'm going to do it all bilaterally. Okay, it is 2 plus. And then the last one is the dorsalis pedis pulse. Have the patient relax his feet. Okay. And then it's 2 plus. Okay, and that is the end of the vital signs video. Thank you.